Welcome back to my video blog series, Out of the Problem into the Solution. Today I want to talk about the importance of having a balanced body, mind, spirit approach for effective chronic pain management. A lot of people misunderstood why we have such a problem in chronic pain. Today, chronic pain patients are usually given what is called a biomedical model of treatment: pills, shots, pain interventions, surgeries, other types of procedures. And they have a mistaken belief if they just find the right one or the right combination of those, their life will be healed, they'll be saved. Unfortunately, for many people, that is not the case. We need to work with the whole person. In addition to the medication management plan, we also need to encourage people to have healthy diet, nutrition, and exercise. We need to teach them the role of flexibility and mobility, stretching, how to appropriately take care of their hygiene needs, dental and physical hygiene needs. All this plays into making a healthy person. Then we move into the psychological realm. This is the area of learning how to more effectively managing our thinking and emotional regulation. To look at our thinking, we first must explore what our mistaken beliefs and skewed perceptions are that lead to the thoughts that flow into our heads. Now, the typical human brain has thousands of thoughts go through our mind every day, and we only focus on a finite number of those. Unfortunately, sometimes we pick the wrong ones. I remember my karate teacher, Sensei Richard Kim, would tell us this Zen parable. It's real simple. He says, let your thoughts come in through the front door. Let your thoughts go out through the back door, but don't serve them tea. So in other words, I don't want to entertain these problematic thoughts. I cannot stop thoughts that come into my head, but I can choose to choose other thinking or to challenge those thoughts. When we have a thinking response, the next thing that happens is it triggers an emotional response, and we have feelings. And these can be uncomfortable. I don't label feelings good or bad, they're comfortable or uncomfortable. So we need to teach some really good emotional management plans, emotional regulation, and then we need to look at the social component, friends, family, community, having better communication with friends and family, setting appropriate assertive limits and boundaries. And then we have the spiritual component, not religious, but spiritual. And with spirituality, what I mean by that is, how do I get the most out of this life by focusing on a power greater than me, whatever that is, and let go of the mistaken belief that I am the center of the universe. One of my patients came back with my assignment that I give all of my patients: come back and tell me simply what you see as the difference between religion and spirituality. She gave me permission to share this. She said, well, Steve, religion is where a bunch of people get together to make a roadmap or plan to get to the next life. Okay, so what's spirituality? He said, well, spirituality is a bunch of people getting together to make a plan for getting the most out of this life and living by spiritual principles, practices, and tools. So we need to work with the whole person, we need to heal the whole person, and I believe a body, mind, spirit approach is necessary. And sometimes appropriate medication management is a very necessary and needed component of a healthy biopsychosocial spiritual plan. So thank you for joining me, and please check out the other video blogs and my video blog archive for some more tips and tools. And on my website, www.drstevegrinstead.com, you'll also see an articles page and an articles archive with a lot of free tools and tips for those of you working with people with chronic pain, or those of you like me living with chronic pain. I have to practice what I teach. So I have to constantly be looking at my levels of functioning, biologically, psychologically, socially, and spiritually, and being honest when I have deficits and making a plan to get out of the problem and into the solution. Thanks for joining me.